We get caught up all the time in, these complicated treatments that we are doing, medications, all these complicated therapies. But sometimes it's the smallest things, the smallest favors that we can do for patients that really make the biggest difference.
State the nature of your medical emergency.
I had this 90-plus-year-old guy who was coming in. I don't even totally remember what he was coming in for, but he was just one of those pleasantly demented old guys, at least so I thought. When we were admitting him, he basically just kept going on and on about this jalapeno cocktail recipe that cured him of his headaches, and how he kept recommending that we buy a mixer and make this jalapeno cocktail mix. And I was like, okay, this guy's clearly not totally with it anymore. The next morning I saw him, and his topic of interest was garlic, and he just wanted to continue talking about garlic the whole time. I was asking him how he was feeling, and he just wanted to talk about garlic, how it was so useful for him, and how it cured him of so many different ailments. At the very end of talking to him, he asked me if I could get him some garlic, and this is an interesting request. A lot of times patients will ask us if they want some orange juice. We'll go ask the nurse, or sometimes they'll want a blanket. And it's kind of hard in the morning because when we're pre-rounding, we're a little bit on a time crunch. So, I thought, I'm a little bit on a rush right now. I think this is low priority. Said I'd look for the nurse. I tried to look for the nurse, didn't find them. So I was like, okay, he'll just forget about it, and then I'll just see him the next time. What ended up happening, though, is when I saw him much later, he basically was like, yo, nobody's giving me my garlic. I've been sitting here waiting for it all day. And it was at that very moment when I was like, man, I should have gotten this guy his garlic. So basically I apologized and told him, okay, I'll actually go talk to your nurse this time. I talked to the nurse. We went down. He said he would call the canteen, get the canteen to provide 3 to 4 cloves of garlic for this guy. And we got it to him for his next meal. And you won't believe me about how happy he was the next time I saw him. He was so thankful, so appreciative. He kept giving me so much life advice about how garlic was going to cure me, clean out all my arteries, and how I could put it below my plants to clean out aphids that were growing on plants. Like, honestly, this single piece of garlic that I worked with the nurse to get him did more for him during this hospital stay than probably any of the treatments or therapies we gave him. Like, we gave him some antibiotics or something, but I don't think he cared about that. All he really cared about was his garlic. And so this totally was a good reminder to me that even as doctors, sometimes these little tiny actions that we can do, these little favors that we can do for our patients are so important. The other thing I remembered is that age is still just a number. Even though he's in his 90s, he seems like this demented guy. He can still be very, very clear-headed and know exactly what he wants about things. So just because he's old and probably has a little dementia doesn't mean I can discount and just make something a low priority because I feel like it's not that important. And finally, the last lesson I learned is that maybe I should be eating some more garlic because that guy was super sharp, at least for his age, and doing pretty well. So I was pretty impressed by that. So I'm definitely going to try and eat some more garlic in the future. But yeah, there's a lot of interesting things that happen in the hospital, and it's just always a constant reminder. We get to partake in some very unique and funny experiences, some very memorable things, and so this garlic experience I'm probably going to remember for a while, and it's a good memory to have. So it's one of the things that's really rewarding about this job.